We'll go next to Dr. Marshall, and then for the sake of the committee, after that, we'll take a 15-minute break to go vote, and then we will come back and continue. Dr. Marshall.
Dr. Monarez, despite the President's executive order, did you encourage people to work remotely ever?
I did not encourage people to work remotely.
Okay. There were allegations that you took some of the political appointees and you basically took them out of your orbit, out of your office area. Did you reassign office location, desk location for the political appointees?
So I do want to go back to your first question. After the shooting, I allowed staff to work remotely.
Okay, you can give us the details of that later. The second question, did you push political appointees out of your main office area, reassign the political appointees seating?
I brought some political appointees in.
My question is, did you move some out?
So there's a limited number of offices in my
Did you, I guess a yes or no, did you move political appointees out of your main orbit?
and I brought other political appointees in.
Okay, you can give us the details of that later. Do you believe every child over the age of 6 months should have a COVID vaccine at least annually?
I believe that is a discussion that a parent needs to have with their pediatrician. And if it is right for that child, based on the risk, then that child should have the opportunity to get the vaccine.
If there's reports come out that show that indeed the COVID vaccination led to the death of children, would that influence your advice?
Certainly would want to know about that.
Okay, the CDC currently recommends between 70 and 80 shots over the child's lifetime. Do you fully support that recommendation that every child needs every vaccine as recommended by the CDC?
The data associated with those recommendations has been validated and vetted. That is the current schedule.
So you agree that you support every child needs every vaccine that's on the CDC recommendations, all 70 to 80 jabs?
The childhood vaccine schedule has been vetted and validated through science and evidence. The almost 20 different diseases that are mitigated through those vaccines are very important. I think that every parent should have the opportunity to talk to their pediatrician and make sure that they understand the benefits and the risks of those vaccines and what is in the best interest of their children.
Do you believe any or all of those should be mandated?
CDC does not mandate vaccines. What CDC does is provide the evidence associated with the recommendations so that a parent and a physician can make the best determination for them.
When you were considering this job as CDC Director, was there ever any doubt in your mind that you could fulfill the mission to work with Secretary Kennedy?
There wasn't. I have worked for political appointees and politicians for almost 20 years. And my experience has been when it comes to critical and important issues like science and medicine, data has always been paramount, and it has always been the core driver to how we work together.
Would you agree with me, though, at this point in time, that you're not the right person for this job, that your belief system, thinking that every child needs every vaccine, which is what your CDC does, every child needs every vaccine, all 70 to 80 of them, is certainly a different mindset than Secretary Kennedy's. And that if the university president, I think a great sports analogy, I hate to do this, but the university president and the athletic director decide you're not the right coach for this team, then it's probably time to say goodbye and we need a new coach. Would you agree that certainly you're going in a different direction philosophically than Secretary Kennedy is?
So I will stand behind scientific integrity with every decision I ever make. If I am put in a position of having to say, I will cede scientific integrity to retain my job, then I am not the right person for the position. I believe that we must have science and evidence to support the best decisions for our children and others who would benefit from vaccines.
So I think here's the biggest difference in philosophy that I see, is that I think the CDC is the cause of vaccine hesitancy, that you are the problem, that because of COVID and you're forcing these vaccines on people that weren't ever really proven or justified, that the benefits didn't outweigh the risk, and you all sat there with your hands in your pockets and you let that happen. And then you let this hepatitis vaccine be at 1 day of age, be forced upon everybody. and all of a sudden, the moms and the grandmas never trust you because you're trying to force a vaccine that's not necessary at day one. If you're going into nursing school, medical school, absolutely, you should consider that hepatitis vaccine. But basically what the CDC does is act like a mandate, and you force doctors that don't agree with you to kick patients out of their clinics because they don't want their child to be exposed to a vaccine that was approved after just like 140 patients took it, being followed up for 5 days. It just makes no sense to me that every person needs every vaccine. But regardless, some of the vaccines have done incredible work. They are a miracle. They've done a great job. The basic vaccines that we got in the 60s and 70s, polio, MMR, DTaP, those seem to be great vaccines that have told the test of time. But your attitude here that every person needs every vaccine is completely contrary to Secretary Kennedy's philosophy and the mission of the president. Thank you.
So as announced earlier, we will stand